Hi, my name is Adrienne, and I'm a certified child life specialist here at CPMC Sutter Health in San Francisco. A child life specialist is like a teacher in the hospital. We use different teaching tools to make sure that kids and their caregivers know what to expect on the day of surgery. If you're feeling a little nervous or scared about your upcoming surgery, that's okay. Let's explore and talk about who and what you will see during your hospital visit. First, you will check in at the registration desk on the 4th floor. A unit clerk will be there to help check you in and give you a bracelet with your name and birthday on it. Children and parents can wait in our playroom until the preoperative nurse or pre-op nurse comes to take you to your pre-op room. Your pre-op room is where you will change into your hospital pajamas, and your nurse will check your height, weight, and vital signs. It might feel like a long walk from the playroom to your pre-op room. See if you can spot some hidden creatures on the flower wall while you walk to your room. Your nurse will first take your height before you change into your hospital pajamas. Your nurse is able to take your weight by having you sit on the bed.
Okay, Celia, we're gonna get your weight now, okay? So let's get you to hop up on the bed. And it's gonna tell us how much you weigh right down here. It's 52 pounds. Nice.
Next, your nurse will take your vital signs. Vitals are what helps us know how your body is doing. Your nurse will take your temperature with a thermometer and use a blood pressure cuff and pulse oximeter.
Have you ever had your blood pressure measured before?
Yes, I think so.
Okay, well that's what we're gonna be doing right now. I'm gonna put this on your arm and it's gonna give you a tight squeeze. You ready? Right up here. And how about a pulse oximeter? Have you ever used a pulse oximeter?
No.
No? Okay, so let me show you this. This is a pulse oximeter. And this goes on your finger. We will use this pointer finger. See how it matches with the picture? You can wrap it and pull it down like this. And then there's a red light in there that you can see. You see it? Do you see it on the side? I like to call it a glowy Band-Aid.
The pulse oximeter tells us how much oxygen is in your blood. Your nurse will check your ID bracelet. This bracelet tells us your name and your birthday, and many people will look at it while you are here for surgery. If you brought a stuffed animal with you, it can have a bracelet too.
Do you think that Teddy would like to wear a hospital bracelet like you are wearing?
Yes.
Okay, let's put one on him. Should we do it on this arm or this arm?
This foot.
On the foot! We'll do it on the foot. Good idea. Okay, Teddy, time to get your hospital bracelet. There we go. Teddy is all ready. Yay, Teddy!
Next, a child life specialist like me will come into your room to visit.
Hi there, my name is Monica. I work here as a child life specialist. I'm wondering, what's your name?
Celia.
Celia, hello. How old are you, Celia?
6.
Your child life specialist will show you a mask. The mask fits over your nose and your mouth. The doctor connects the mask to a tube that gives you air and medicine that will make you very sleepy. Some kids say it looks like a space mask and feels soft and squishy. You can decorate your mask with some stickers and markers if you would like. You can also choose a scent for your sleep air. Some of our flavored scents include strawberry and bubblegum. We have a whole list you'll be able to see and choose from. The doctor that gives you the sleep medicine through the mask is called an anesthesiologist. Their job is to make sure that you are in a deep sleep so that you do not feel anything during your surgery.
You're just gonna put the mask on your face, just like that, and I'm gonna hook a little piece of plastic up to that, and you're gonna go right to sleep.
When you meet this doctor, they will ask you questions and sometimes even need to see your smile and check for wiggly teeth. You will also see your surgeon. Just like you, they have to wear special clothes when they are in the surgery room called scrubs. The room where the surgery happens is called the operating room. Some kids call it the fix-it room too, and a parent can come with you. Your parent will have to put on a big white jumpsuit over their clothes and wear a blue cap. A lot of kids usually think their parent look like a bunny or a space astronaut. In the operating room, you will meet many more people who are there to take care of you. They will all have on scrubs, just like your doctor, and blue hats and also masks. This helps to keep the operating room very clean. When it is time to go to sleep, the mask will gently go on your face and you will breathe like you normally do. You might start to feel a little silly, and that's okay. Your anesthesiologist might even tell you some jokes. You can help them to hold the mask, or you can hold your parent's hand as you fall asleep. After your surgery is over, you will be taken to the recovery room, also known as the wake-up spot. The wake-up spot may have some trees and animals you can spy on the walls. You might hear or see other patients who are finished with their surgeries too. As you wake up, a nurse will be there to take care of you, and your parents will be there too. After your surgery, you might feel sleepy or dizzy, or you might also feel fine. You might have a small plastic straw that's taped to your skin. This is an IV straw. It is small and flexible and goes under your skin and into your vein to give you medicine and water during your surgery. Your nurse will gently take it out when it's almost time to go home. Once you feel more awake, your nurse will give you a popsicle to eat and some juice or water to drink. After you eat and drink a little, if you're feeling good, you can get dressed to go home. Once your nurse talks to you and your family about taking care at home, you're ready to go. Also, there's one more thing. Some kids who come in for surgery and are planning to stay overnight will be rolled on their bed to a private hospital room on the 7th floor. The 7th floor is the Pediatric Unit, where you will have doctors, nurses, child life specialists, and many more care team members working hard to take care of you and make your stay more comfortable. Once you are feeling more awake and ready to play, a child life specialist can bring fun activities and fun toys to your room. Some kids may even have the chance to visit the pediatric playroom or teen lounge before going home. Now, before I go, I want to go over a few questions that come up sometimes. And don't be afraid to ask us other questions if you have them.
Can I eat before my surgery?
You will not be able to eat the morning of your surgery. The air that you breathe in through the masks puts your body into a special kind of sleep, different from when you sleep at night or when you take a nap. This medicine tells your stomach it's time to sleep, so that it can't do its job of digesting food. If your stomach is sleeping and there's food in it, you might get sick. But don't worry, you'll be able to eat as soon as you wake up.
What if I wake up during my surgery?
Your anesthesiologist's whole job is to make sure that you stay asleep and don't feel anything during your surgery. They know exactly how much medicine to give you and will be monitoring you during the entire time to make sure your body stays safe.
Will it hurt?
Going to sleep will not hurt at all. Depending on the type of surgery you have, you might feel a little bit sore when you wake up. There will be a nurse there to give you medicine if you need it.
Hi, I'm Ian, and I'm 16 years old. How does surgery look different for kids my age and older?
For teenagers who are 13 and older, a pre-op nurse will place an IV, intravenous catheter, before going to the operating room. The IV will be used by the anesthesiologist to give teens anesthetic medication. Some teens have said that the anesthetic medication feels warm and tingles as it travels into the vein, but it lasts only a few seconds before they fall asleep. If it's your first time receiving an IV, your pre-op nurse and child life specialist can provide preparation education to help support you. We hope that this has helped you know what to expect on the day of your surgery. If you have any questions, feel free to ask, and we will see you soon.